When it comes to Gemfibrozil, or if you want what we call sometimes fibric acid derivatives, these fibric acid derivatives, they are actually drugs that are not used for high cholesterol because their effect is induction of lipoprotein lipase. And you know, students, cross out the word activation and include the word induction to be correct. This induction of lipoprotein lipase, as you saw in biochemistry, is associated with stimulation of peroxisome proliferator activated receptors. I hope that all of you have looked at your biochemistry before you have even started the idea of reviewing pharmacology. It is in the biochem section in molecular biology that we established that PPARs are transcription factors to mediate the responses of insulin on not only lipids but also carbohydrates. So as such, what we're seeing with a drug like Gemfibrozil is the bypassing of an insulin receptor to directly stimulate PPARs and have insulin-like responses. You know what it means at the level of fats. Insulin allows storage of fat. And when you store fat through lipoprotein lipase activity, you are effectively removing it from the blood to put it in tissue. Now, you might cause weight gain with this, but at least you will work on hypertriglyceridemia. Here's the issue, though. You are increasing the catabolism of VLDL and IDL. In some patients, the drop in those lipoprotein will result in a modest drop in LDL. But in most patients with hypercholesterolemia, because they don't have a functional LDL receptors, or they have an imbalance in picking up the LDLs, the catabolism actually will result in a buildup of LDL in the blood simply because they cannot clear it and they've catabolized more IDLs, potentially producing more LDLs. So this is a drug that should be contraindicated in people with hypercholesterolemia, just used in simple hypertriglyceridemia. Gemfibrozil is also a drug that will result in gallstone risk. Remember that fats are not cleared through a kidney unless you have a nephrotic syndrome. Lipids are cleared through the bile. And as I'm forcing more lipids into tissues, I'm also helping more clearance of those lipids by the biliary duct. Supersaturation of bile by lipids will result in gallstones. It's a little bit like the story of a fat female fertile in their 40s where they can form cholesterol stones. Well, here instead of cholesterol, we're talking just pure lipids. The myositis is primarily an issue when you were attempting to use Gemfibrozil with a statin, maybe with the hope that you would have both hypercholesterolemia and hypertriglyceridemia being taken care of. Well, don't do this. Remember, there is a problem with the clearance of the statin.